All right, let me say good evening, good afternoon, everyone. We're going to do this in two phases. I want to make this special announcement about our personal protection equipment drive for Houston Frontline. And then the second part, when we finish this first segment, we'll give pretty much a status report as to where we are in our fight to defeat COVID-19. Houstonians compassionately respond when tragedy or crisis arise. That's just our nature. Over the past few weeks, we have seen individuals, organizations, and leaders face the greatest health and economic crisis our city, our nation, and our world has faced in over a century. And what I know is that our fellow Houstonians are strong and resilient because of our character and driven by a passion to rise above adversity and help our neighbors. That is just who we are. For the many businesses, residents, and community groups who are looking to give back now, the Astros Foundation, Project Cure, and Cheniere Energy have partnered together to organize a personal protective equipment drive, and it will be held on Wednesday, April the 8th, from 12 noon to 3 p.m. at Maid Park on the 500 block of Crawford. And even as I read this, Twilight, I'm reminded of when we were facing Harvey, how the Astros stepped up and really helped the city of Houston in a major way. And I'm pleased to say that the Astro Foundation, along with Project Cure and Cheniere Energy, are here to do it again on April the 8th, Wednesday, 12 noon to 3 p.m. The city of Houston is in need of personal protective equipment. You've heard me say that over and over again. Even as late as yesterday, I was asking for donations to support the Houston Frontline. Our first responders, essential function personnel, Houston Parks and Recreation Department, Meal Distribution Center, and the city's Homeless Outreach Initiative, as well as our COVID-19 testing site. And some may ask, Mayor, why the need? I know contributions have coming in. I was sharing with all of them earlier before we came out. The Houston Fire Department alone burns about, roughly about 10,000 units when you put it all together per day. When you talk about the gloves, the goggles, the gowns, the face masks, and then the police department is burning quite a number of thousands per day. Chief Acevedo can attest to that, because now we're at the point of assuming that everyone we come in contact with is pretty much has COVID-19. We have to assume that for the safety of our employees. The health department, Director Williams can attest, they are the ones that are out there manning our testing site. So we're going through all of these materials, these personal protection equipment items, at a very fast rate, and we know this is not a sprint, this is a marathon. I am so grateful that Project Cure, the Astros Foundation, and Cheniere Energy have designated the city of Houston to be the beneficiary of this drive, and on behalf of Houston, I want to say thank you. Distribution of the PPE to the front line will be managed by the City of Houston, Office of Emergency Management of Susan Christian and her team, and Project Cure. And let me just stop and please welcome the Director of National Procurement for Project Cure, Ms. Janice Thomason, to detail this partnership and the PPE drive for next Wednesday. Janet.
Thank you, Mayor Turner. For 32 years, Project Cure has saved the lives of people in developing countries. Now, in response to the COVID-19 crisis, we have pivoted the resources of Project Cure to focus on the needs of our nation. Over the past 2 weeks, Project Cure has distributed over 1,200 cases of product into our Houston healthcare community alone. We have sent ventilators, masks, gowns, gloves, and more. Well over $1 million in donated supplies have been shipped from our 7 warehouses, and we will continue to do everything in our power to support our medical communities. We are here today to reach out to our Houston community and ask for your support in collecting as much needed personal protective supplies to give to our doctors, nurses, and first responders throughout Houston. We are proud to partner with our sponsor, Cheniere Energy, the Astros Foundation, and the City of Houston. If you or your organization has an available supplies of the items we are collecting, masks, gowns, coveralls, hand sanitizer, alcohol, or gloves, please donate these items to support our frontline responders. Look in your storage rooms, companies. Look in your hearts. Donate those items to those who care for us. A detailed list of needs can be found at projectcure.org, projectcure.org. Our collection will take place at Maid Park this coming Wednesday between noon and 3 p.m. on Crawford Street at the entrance between Texas and Congress. This will be a touch-free collection, and we will, of course, follow all CDC guidelines. You will be asked to pull up your vehicle, and volunteers from our community will unload your supplies. If you're unable to deliver on Wednesday, you can drop off at our Houston location. In closing, I'd like to thank the doctors, the nurses, the healthcare systems, the EMTs, who are waging a fight against COVID-19, many of whom have supported Project Cure both here in Houston and globally through their volunteer service and donations. It is our privilege to be able to support their heroic work at this time. For more information on the collection, on how to donate goods or funding, request supplies, or learn more about how Project Cure is battling the coronavirus, please visit our website, projectcure.org. Thank you.
Thanks, Janet, and I also want to acknowledge Mayor Pro Tem Dave Martin for being here as well. Houston is filled with amazing and supportive companies, and here to discuss their community initiative and partnership with Project Cure, please welcome Mr. Jack Fusca, President and CEO of Cheniere Energy. Jack.
Thank you, Mayor, and thank you for your leadership during this difficult time. So I'm Jack Fusco. I'm the President and CEO of Cheniere Energy. For those of you who don't know us, we liquefy natural gas and we ship it out all around the world. Our headquarters are right here in our hometown of Houston, and our two sites, one's at Corpus Christi in Texas, the other one's at Sabine Pass in Louisiana. And I have to say, safety at our facilities is job number one. So when our employees walk in through that gate, first thing they do is they don their PPE. So they put on their hard hats, put on their safety glasses, put their gloves on, and they put their work boots on. When we heard about Project Cure and that the possibility that our first responders here in Houston may not have the appropriate PPE to do their jobs safely, we knew we had to get involved. So Janet, I'm here to add to what you said. If you don't have any of the supplies that Janet listed to donate, then we'll take cash. So Cheniere will match dollar for dollar up to the first $50,000 to Project Cure to ensure that we have enough PPI for those folks that are testing us, or testing, that are treating us, that are feeding us, that really, really deserve all of our love and all of our support. So with that, from the bottom of my heart, we're pleased, Mayor, to be able to help in this initiative.
I'm glad that Jack said that they was going to be matching dollar for cash up until the first $50,000. I was waiting for him to say that. On Monday, we will have a gentleman here who will be donating $100,000 to HPD, $100,000 to police, $100,000 to fire, police, and to the sheriff department for PPEs, and that will be on Monday. So thank you, Jack, in case you want to heat up. Well, the reality, I didn't know it was going to be the cash. The gentleman called me last night and said he wanted to do something. And so on Monday, we're scheduled to be making that announcement on Twyla? Look, in times of celebration and tragedy, the Astros Foundation has always been one of the first to step up to the plate to partner with the City of Houston to serve the community. And we are so appreciative and thankful to the Astros Foundation. Please welcome the Executive Director and Senior Vice President of Community Affairs, Ms. Twyla Carter, to discuss their role as well. Twyla.
I'm going to stay on script here, so don't you worry. You remember you said you were trying to reach Jim? Keep trying to reach Jim. Just wanted to give a shout out and a huge thank you to the leadership of our City of Houston. Up until right then, it was all good. But no, thank you to the leadership of the City of Houston, to our first responders, our healthcare workers, for your service and sacrifice. You all continue to go above and beyond your call of duty. I want to thanks to all of those serving on the front lines during this time of need. You know, some of the things we don't think about, there are outreach teams working to meet the needs of the homelessness. There are folks over at the community centers with the Parks Department distributing meals to our youth in the community. Those working to keep the testing sites up and running. Thank you for our dedication to the city. Those are all part of the groups that use the PPEs that we're talking about. Thank you, Jack and Chenier, for your steadfast support to the City of Houston, the Houston Astros, and most importantly, in organizations like Project Cure. You are valued partners to the Astros Foundation, and you continue to step up to the plate, and we thank you. Thank you, Project Cure. Janet, we volunteer with Project Cure year-round for your efforts on the behalf of so many that you serve. Your service to poverty-stricken countries is invaluable to our community, our own community, during this unprecedented event. Friends, the mettle of our city has been tested, but time and again, we have proven that we are stronger together, witnessed by all of these individuals on the stage here who continue to step up and give. To everything there is a season and a time, to every purpose under the heaven. Your Astros stand with our city in all seasons, in times of celebration and in times of need. May God continue to bless our city of Houston and all who work together to make Houston a better place. Thank you.
Let me thank everyone again, to Chenier Energy, Jack, thank you so very, very much. To the Astros Foundation, Twyla, thank you. And to Project Cure, Janet, thank you so very, very much, and the organizations you all represent, for your love for our city and our brave employees who continue to serve our community. And again, we are enormously grateful. And oftentimes, we somewhat overlook, but we have our hot teams with the Houston Police Department who are out there on the front line, really responding to our homeless community. And the PPEs that we are needing and that we are hoping you will donate will benefit them as well, who are out there every day trying to make sure that our homeless population receives what they need, and especially our most vulnerable communities. So at this point, let me stop. If members of the media, if you have any questions with respect to this initiative, now would be the time to ask any of these individuals.
My question goes to Janet. Thank you for coming, and thank you for the work that Project Cure does. We appreciate your effort in Africa and other continents like India. There will be people who will listen to this and want to find out if, since most of the equipment which are donated and collected at Westheimer and Denver, most times are used, there are people who are like, they also use masks, they also use ventilators. Some of those items autoclave. What are the sanitary measures which have been put in place? You are assuring the people that the monies given will be used to purchase new equipment. Thank you for the great job that you do, and thank you for answering my question.
Thank you. I think if I understand your question correctly, you're asking about how are we preparing the equipment to distribute into our community. Project Cure works directly with the clinical engineering departments if we do donate a piece of equipment. So not only has the item either been reviewed by us, it's going to get a second level of review in the facility where it's donated. And most of the items which are being donated in full manufacturer boxes, so they're going into the hospitals, and their supply chain will again have an opportunity to review it before it gets put into use, just as the city will be bringing into their warehouse and review before the items go into use. Thank you.
Mayor or anybody on stage, do you have a take on how much we have in the city as far as our stockpile of PPEs, and how much are you looking to get in donations to sort of help in the need?
If I can kind of, off the top of my head, I don't have the list in front of me. In terms of N95 or KN95 masks and supply, it's about, let's say about 200,000 of those currently. Chief, you may be able to know it offhand. In terms of gowns, for example, there are, let's say, a little bit more than 40,000. In terms of gloves that are used by all fire, police, health and human service workers, in terms of gloves, there may be about 2 million pair, but we go through those at a very, very rapid rate. In terms of thermometers, there may be, let's say, between 1 to 200. In terms of, what am I missing? Goggles, there may be about 3,000 to 4,000 of those. And what am I missing at? In terms of shields, there are about 700. And I hit the gloves already. So that's pretty much the major items. And now, let me just say with masks, when I say end up in 95, say about 200,000, we will go through those. The burn rate is very, very high. The burn rate for masks, for gloves, the shields, the gowns, that burn rate is very, very high. And we anticipate we're going to be in this battle, let's say for the next couple of months. Let's put it that way, okay? And you don't want to get down to within a week or two. You really don't want to do that. So we really need to go even beyond.
So you're looking at, I mean, ideally, what, stockpile like 1 million or 2 masks?
Ideally for the N95 mask or the KN95 mask, which in terms of quality, about the same, we would like to be well over 1 million for a city of this size. We're the 4th largest city, well over 1 million, yes. We have about, I think at this point, 500,000 are scheduled to come in next week on the N95. But we really need to maintain a stockpile over 1 million on the N95 because all of our police officers and our firefighters now are wearing them and keeping them on. You know, that's a must. And the same thing for our health employees. I don't want to forget them because they're the ones who are staffing the test sites. So it's very important for them to keep them on.
I have a question for Janice with Project Cure. So what is the scope of the people who can be donating during the drive on April 8th? If there's someone who's watching at home who says, I have a couple masks, I have 10, versus someone who has, I have 50 to 100, can you give us a little more instruction for those who are watching this, what this means for them and how they can donate?
Absolutely. When we look at who can donate product to this drive, we're looking to everyone. There are people who happen to have a hobby that utilizes full boxes of gloves or full boxes of face masks or perhaps gowns. As long as they're in complete boxes, those can be donated for this drive on Wednesday. If you have smaller quantities, we could look at those into our facility as well, but not for this Wednesday. We're looking for full boxes to go into the community. So it can be anyone. I had a great organization reach out the other day, and they did bonsai trees, and they had a shipment of 6 cases of masks and gloves, and they can donate. We're looking at industries, paint shops, production facilities, any of those businesses. They need to think, what do we have, what do we use that can be used? It can be an isolation gown, technically from a medical standpoint, but we can also use coveralls. We're looking for anything that will help protect these first responders. And I'd like to add one more thing for the previous question as well, to give you an idea of scope. Our international headquarters is located in Denver, and 2 weeks ago we did a drive there, and that yielded an entire semi-truck full of product, 25 pallets of items. We are Houston people. We can beat them, okay? We have a lot of industry. We have the Astros behind us. Let's look in our basements, and I say look in our hearts. And I think there's a lot of businesses around Houston who might not realize what they have is going to save someone's life. We need to protect these people on the front line.
But complete boxes.
Complete boxes. So that would be a sealed box of nitrile gloves, a sealed box of N95 masks, things like that.
And have you guys approached, some O&G companies and things, especially with their side of the business maybe slowing down, that, upstream, downstream people, perhaps they have large quantities of masks and things like that?
Yes, we have approached some, and we're hoping through this outreach and with the support of the Astros, with Cheniere and the city behind this drive, that we can reach all those companies out there, large and small, who might be able to support us in this drive. We need to get the word out to everyone. Thank you.
And let me just say, and if you don't have the supplies themselves, the cash contribution would also be very helpful. Because if we can bundle enough, and all of these dollars are going for the purchase of PPEs, okay? And a lot of people have been asking, Mayor, what can we do to help? This drive is one way of doing that. Whether you are businesses, corporations, individuals, we can all do something. Okay, any other questions?
My question to Shene, executive or representative.
I think to
first,
Jack.
What is it about OSHA and protective equipment that the oil and gas and energy companies may be having that could be of use to this drive? And secondly, some of the difficulties that we are going to have are related to the problems of the energy sector. There are lots of the energy companies that are going to lay off workers because of the downturn and other related issues. So as you're trying to help the city and we are working together, how do you think that the city could come to your help, especially as our Honorable Sheila Jackson-Lee said, she's fighting for the city and for everybody, and maybe she could be of help to energy if you so request or demand.
Well, just to be clear, so we're fortunate enough that we have sold all of our liquefied natural gas, about 90% of everything we expect to make for the next 20 years on long-term contract. So at our sites, we're stationed in place. So we have camps, and our critical operations and maintenance folks are living there 7 days a week, 24 hours a day. And we're continue to export 2 tankers of natural gas a day from our facilities through this pandemic. And so we're trying to do our part by keeping everybody gainfully employed and keeping our construction efforts going through all of this downturn. But more specifically on the OSHA, what do facilities like oil and gas companies have? Just everything that Janet listed, we would have and they would have. So hopefully I can try to influence some of my colleagues to do the right thing over the next few days and make us all proud to be Houstonians.
All right, again, I want to thank all of these organizations and individuals, and that the PPE Drive is this coming Wednesday, April the 8th, from 12 to 3 at Minute Maid. And Janet, I like what you said. What Denver did, Houston can do even better. So please come out and support our police department, our fire department, all of our Houston Health Department, all of the employees who are out on the front line to assist and keep our city safe. So thank you so very, very much. We're going to segue now to the second part, so thank you all. Thank you. So Chief Pena, Chief Acevedo, if you want to come up, Dr. Purse. All right, we try to provide these status reports every day, and in terms of where we are in our fight to defeat COVID-19. Today, and let me just give you today, the Houston Health Department is reporting 81 new cases of COVID-19 today, bringing the total count in the city of Houston to 587. Sadly, the total number of deaths has increased to 8, so that's 2 more than one existed yesterday. So we're at 587 in terms of the count in the city of Houston for those tested positively for COVID-19, and the death count is at 8. Let me say to you, we're doing much more testing now in the city of Houston, and it's not just the testing sites that the city of Houston has, but there are also additional testing sites in the city of Houston. So we expect those numbers to rise. We expect those numbers to rise every single day. Sometimes, like yesterday, the number could be 48 or somewhere in that number range. Sometimes the numbers could be 81, like today. Sometimes the numbers can be more than that. But what is the objective? The objective is to rise at such a level, to slow the progression, so that whatever the number is, the people who are needing to be attended to in our hospitals can be attended to. Those that may require an ICU bed, that they can get an ICU bed when they need it. That there is not a problem, for example, with ventilators. So the goal is to blunt the progression of this virus, to blunt it, to flatten the curve, so that we can stay within our healthcare delivery system's ability to provide the necessary care that is required. That's the goal. So it's not so much the rising number, is how many are needing to come into the hospitals and to get to utilize those beds, and then how many can self-resolve their situations at home. And as of today, we are able to handle the load within our healthcare delivery system. That's where we are. So again, I'm going to continue to ask people if you will engage in the social distancing. Stay at home unless you're working for an essential employer. Stay at home. That's important. You can still go to the grocery stores. The grocery stores, there's not a problem with the food chain or anything of that nature. So grocery stores are not shutting down. You continue to go to the parks. But let me just say, if you go to a park and it's crowded and you can't engage in social distancing, then either find another park in the city of Houston or, kind of go, stay in your neighborhood and walk or jog right down the streets in your neighborhood. So those are the things that are very important. In terms of the 2 new deaths that we are reporting today, and Dr. Peirce can speak more to it, it's a male in his 40s with underlying health conditions who passed away on March 27 of this year. And then a female in her 60s with underlying health conditions who passed away on April 1st of this year. Starting today, the Houston Health Department will release demographic information about the city of Houston's COVID-19 cases, such as the number of positive cases, the patient's gender, age group, recovery status, and deaths through HoustonEmergency.org. That's HoustonEmergency.org. And we'll also be sharing that information with ReadyHarris.org. The information will be updated daily at 4 p.m. And available online. And the Houston Health Department reports cases involving residents of the city of Houston, including the incorporated areas of the city extending outside Harris County. Harris County Public Health reports cases involving residents of unincorporated Harris County. And then let me also say, because there have been some inquiries, and so let me clear the air, any city of Houston employee that tests positive for COVID-19 will be presumed to have a work-related acquired COVID-19 illness. So let me say that one more time so we'll be very, very clear. If you are a city employee, police officer, firefighter, municipal worker, if you test positive for COVID-19, the presumption will be it was work-related. That will be the presumption. So there have been some reports saying that was not the case, but I want to be very clear, I want to speak directly to the employees. Let me speak directly to people in the fire department, directly to our personnel, police officers, directly to municipal employees. If you test positively for COVID-19, the presumption will be by this city that it was work-related for workers' comp purposes. Firefighters who are placed in quarantine for COVID-19 action are initially carried on workers' compensation. If the employee develops no symptoms, does not meet the criteria for testing, and receives no medical care while in quarantine, and the workers' comp claim is denied as a result, then the employee will be carried on an alternative pay code that will track the employee's absence from work but not reduce the firefighter's personal benefit time. So even if you are quarantined, and again, let me speak directly to the firefighters, even if you are quarantined, you will be carried on workers' comp. You're not going to lose any of your time, okay? Meals, lodging, all of that will be provided, okay? And so there's no, you're not going to lose any of your time. And then if you are tested positively, if it comes back positive, the presumption will be that it was work-related. I want to be very, very clear, and I want to speak directly to the City of Houston employees, and that applies across the board. At this point, let me yield and let me turn it over now to Dr. Peirce.
Thank you, Mayor. And as the Mayor mentioned, we are saddened to report the deaths of 2 more Houstonians today. One is a gentleman in his 40s. That is the youngest death that we've had, and a woman in her 60s. Both were hospitalized at the time. You note that the dates of death were several days ago, and the reason that they're being reported today is today's the day that we got the tests back that showed that they were infected with the virus at the time of their death. I want to point out that as sad as this is, we need to all pay attention because these individuals were infected by somebody else. I'm not trying to throw whoever infected them, say anything negative about them, but the point is that this is a disease that spreads from one person to the next. And this is why we need to take the precautions that we're taking with the social distancing. The concept of asymptomatic spread is real. In the beginning of this, we didn't think that that was going to play a very large part in the equation with this virus. This is one of the things that's unique about this virus, and that asymptomatic spread seems to be, or we're also calling it pre-symptomatic spread, seems to be a little bit more, a bigger part of the equation than we had anticipated it would be. Therefore, even if you're feeling well, you need to do as the mayor has said, and do not gather, stay several feet away from each other. If you feel ill, you need to stay at home. If you need to seek medical care, do so, but call ahead, let your doctor or the hospital know before you arrive so that we can protect our healthcare workers, which are another precious resource. Please do not call 911 and ask for an ambulance if you don't need the ambulance. Those firefighters are also a precious resource. We can't afford for any more of them to be exposed and suffer the consequences of being in quarantine and the burden that it puts on the department. So these are all very important. Every one of us needs to be responsible. I think that I have seen that people are acting better. Let us not let these folks' deaths have been in vain. Pay attention and do as the mayor asks. Thank you.
Thank you, Dr. Peirce. A question that came up, that's come up several times. We were asked or sent an email, what have you. They said, Mayor, we're doing all of these things for social distancing, we're staying at home. Is it working, Mayor? And let me just say to you, yes, it is working. And when you look at where we are, and let's say draw the comparison to New Orleans, look at where we are, and I think you can see the noticeable difference. And then not just in terms of the number of people that are testing, when we're looking at the number of people that are going into our hospitals, the number of people that are within our ICU, and our capacity and what exists. What Dr. Callender said the other day, that our hospital systems, even as of today, they're able to handle the caseload within our hospital capacity. That's good news. That's a positive statement. And now what will it take for that to continue? It means that those of us who are not in hospitals, those of us who are able to either go to work and work safely or stay at home, we control each other's destiny. You control my destiny, I control yours. And so if we continue to engage in social distancing and follow and be disciplined in what we are doing, then we can help to blunt the progression of this virus. And then the quicker we can come out of it. So again, let me thank you for your cooperation. Let me thank you for your compliance, and I'm hoping that you will continue to do it as we go through this weekend and as we approach Sunday. And I hope you will continue to the faith-based community to continue to worship by online streaming. I so want to thank you for your cooperation. Now, Chief Pena.
Thank you, Mayor. So I want to start by letting everybody know that we are in a manageable situation as far as the inventory of our personal protective equipment to maintain operations, to ensure that our firefighters on the front line have all the personal protective equipment they need to safely do their job. As in regards to the quarantine, today we're down to 141 firefighters in quarantine. Through the course of this operation, we've had 13 firefighters that have been positive for COVID-19. 2 and maybe 3, I still have to get confirmation on the third one this morning, but possibly 3 have recovered from that and are back to work. And in the course of the operation, we've had 48 firefighters return to work after being quarantined for exposure to COVID-19. So at this moment, we are operational. We are staffing every unit that we have available, and we're doing every bit that we can to ensure that we're providing not only the equipment, but the right policies, the right procedures, to ensure that our firefighters are safely meeting the demand in this city. Thank you.
And Chief Acevedo.
Good afternoon. Thank you, Mayor, and everyone up here for your work and your leadership, and thank you for your position on the injury and the exposure for our employees. I think that gives them great sound mind, and it just relieves a lot of folks, and it speaks as to your care for our people. But I'm going to give a quick update on where we're at from a police department. First and foremost, it's important for everyone to know, including the criminal element, as evidenced by our officer-involved shooting earlier today, that we are completely operational. We are operating on all 8 cylinders, and every single unit in the Houston Police Department continues to operate efficiently, effectively, and is deployed. As of today at 1:38 p.m., we have a total of 135 members of the Houston Police Department that are in quarantine. 109 are classified sworn members, and 26 are civilians. 110 members of our department have been tested, 106 classified, 17 have come back positive, 43 have come back negative, and 46 are pending. The 17, 43 negative, 17 positive, 43 negative, 46 pending are sworn members, and 4 civilians have been tested, 4 total, 1 negative, and 3 pending. We have had 2 frontline officers that came back positive. They have returned to full duty, and again, that gives us great hope, since we know that at least 80% or more of the people have very little to no symptoms, but 2 are back to work. We do have 1 member 2 members have been hospitalized. 1 is out, still recovering, but is doing well. And sadly, as I reported yesterday, we have 1 member that is currently hospitalized, and we need prayers. He's on a ventilator, and we ask that you pray for him and his family and everyone that's being impacted by this virus across the nation, across the world. Our call volume, I want to thank the people of Houston. You're calling us only when you absolutely need us. And our call volume since this stay-home order, the essential functions order only, shelter-in-place order, whatever we want to call it, as of this morning, we're seeing a 7% drop in our call volumes, which is really important. Our homicide rate continues to trend downward during this operational period, even though they are up year to date. The 2 exceptions in terms of violent crime that I want to mention, what I think is really important, is aggravated assault and domestic violence. Aggravated assault is up 10%, and domestic violence is just up 0.2%. That speaks to me. Part of that is, we're off a lot of frustration. We're out of our normal routines, but it's important for people to know that we have mental health professionals that you can call. If you call our communication center, we've got professionals at the desk that can help you out. It's important to give yourself space, but most importantly, for the women, the families, the children that are locked up in their homes right now or staying in their homes a lot, if you need us, call us. We will be there. The other area that I think is important to be aware of in terms of of nonviolent crime. It is down across the board with the exception of burglary of buildings, and that speaks to the empty businesses. If you are a business owner who are closed down, you can let us know. Call your local Houston Police Department division, patrol division, and we will include you in our what we call directed patrols to keep an eye on your business. And quite frankly, when you're driving around on essential business out here, we ask the community to please let us know if you see any kind of suspicious behavior or someone driving around. And last thing I want to say is I want to thank Houstonians for actually complying with this order. We have not had to cite anybody. And quite frankly, one of the things that really helped me, and I want to thank you, is taking out the basketball hoops. I'll be real honest, I was almost getting ready to get out and play basketball because it's so tempting. But I think that that was a really huge step on your part and the part of the Parks Department, because it was attracting a lot of folks. So thank you, everybody. And again, if you need us, just know that we are here, especially on our domestic violence, children in the home. If you're abused, please go. When you're talking to your teachers online now, that thank you, HISD. My son Jake is back in class where he belongs online. I appreciate that. But just remember, if you need us, there's a way to get help. You can even do it with your teachers if you're having a problem. And I'm speaking to children right now. We know that a lot of times children that are abused are use the schools to report it. Don't forget, when you get online, you can talk to your teachers, and we'll come in and we'll get you and we'll protect you. Thank you again.
Thank you, Chief. In fact, the word went out that you were about to be out there playing basketball, and they demanded that I take them down very quickly to save us from watching that sight. So they immediately went out and took down the rims. Yeah. Now, at this point in time, let me bring up Chief Beauty. Let me bring up Chief Beauty, Office of Emergency Management.
Great. Thank you, Mayor, for your leadership and guidance during this crisis, and also for some of the tough decisions that you're making to keep this community safe. I'd also like to thank my partners up here on stage, Chief Acevedo, Chief Pena, Dr. Peirce, Director Williams, and Councilmember Martin. Thank you for your partnership in working together to keep this community safe. I'd also like to thank the members of our Office of Emergency Management that are doing a lot of behind-the-scenes work, coordinating the different task forces, keeping situational awareness, and managing the donations and then the PPEs. I want to thank Project Cure and encourage people to donate on Wednesday. They're partnering up with Chenier and the Astros Foundation. As the mayor said, we have a sufficient number right now to keep everybody safe, the first responders, but you can really never have enough. We don't know how much that we're going to need in the future. We've heard the mayor talk about and seen some stories on the news, the shortage of PPE, and we know that there's people out there in the community that have access to either PPE that may be in a storage facility or that have access to people that can obtain that for us. We've been working real closely with the U.S. Customs and Border Protection. They assisted us this past week in processing in a timely manner some of the equipment that the city purchased, but also some of the equipment that some others have purchased to get through the customs process so we could get to the proper person so they could donate to the city. The city's still looking for N95 masks, surgical masks, gowns, face shields, goggles, and then one other request that we're starting to get is thermometers. So if anybody has any extra thermometers, if you haven't seen it, there's some buildings that you're going into, just like you're getting tested going through the metal detectors. There's some companies and businesses before you're allowed to get in there. They're actually taking your temperature and asking some questions. So we have to plan for the future on that. Hand sanitizers, we received another 15,000 bottles of hand sanitizer today from Farouk Shami. He was up here last week with a donation. Last week, when we received the 15,000, within 3 days, that 15,000 was distributed out to city employees. We ran out. We received another 15,000 today, and we're in the process of distributing them to the first responders. We have to keep our police officers, our firefighters, our medical healthcare people safe. You've already heard about the number that we're burning, the burn rate, the number utilizing. We only think that that's going to increase in the future. If you're unable to donate or participate on Wednesday, I would encourage you to send an email to the Office of Emergency Management. And here's the email address, donations@houstonoem.org. Thank you, Mayor.
And look, I've been very appreciative of having a very supportive city council. It's a team effort. It's not just a one-person deal, and they've just been very, very supportive. I'm especially pleased of the Mayor Pro Tem, who has just been with me every step of the way. And let me call on Mayor Pro Tem Dave Martin for his comments.
Well, thank you, Mayor. We appreciate any opportunity can we work with the mayor and work with our first responders. Just want to reiterate, as I did my run early this morning, I see a lot of social distancing. I see a lot of young kids and families walking around, which makes us all feel good, and we'll get through this thing. So remember to stay at home and work safe, and we'll all get through this together. So thank you. Thank you, Mayor, and your leadership.
All right, we'll take any questions to any one of these persons.
Dr. Pence, I got a question. The fear of most communities in a medical emergency, a global health pandemic like this, has to do with the mortality. And so I want to ask you a question related to the mortality rate and the coroner's report as to maybe related comorbidities. Houston has done a great job in terms of the fact that so far, after many months of preparedness and response, we're having just 6 deaths. But can we be able to go inside those records and say that some of those deaths would have happened without the coronavirus infection? And what are those features which are actually telling us that some of those deaths which we are getting the virus antibodies to be positive have nothing to do with the cause of death? Because at now, anybody who dies and we can be able to isolate, the virus, we say that, oh, the person died from coronavirus. But it may not be the case. So can you maybe reflect and expound on it?
You asked a very good question. And first of all, one thing I want to capitalize what you said, we've only had a small number of deaths. And so what you can draw from that is that a lot of what we're doing, a lot of what you are doing, a lot of what the mayor is doing is working, right? Now, that doesn't mean we stop, okay? That's what I worry about is that we cannot rest on our laurels at this point, but what we're doing is working. We just need to keep on doing it. To your question about the cause of death, that will ultimately be decided by the medical examiner, and you're right. In all of the cases we have had so far, the patients who have died, those individuals have had what we call comorbidities. They've had other illnesses, whether it be hypertension, asthma, emphysema, whatever the comorbidity, every one of them to the point has had comorbidities. And so then the question that you ask is, well, would they have died anyways and their infection with the coronavirus was just incidental? And that's why we have to wait for the medical examiner. That's going to take them quite a while. As you know, the medical examiner, their final answers often don't take until about 6 months. So right now, as we talk about these, I'm saying these are all coronavirus-associated or coronavirus-related deaths because you're exactly right. We can't say for certain. However, in all of these cases that we know, these are folks that to the best of my knowledge, have expired because of what appears to be the classic coronavirus pathology. In other words, it's been respiratory. The hospitals have been unable to maintain the oxygenation of their blood. Their lungs have become severely damaged. And so at this point, they appear like it's coronavirus, heavily influenced by the coronavirus. But you're right, they have all, so far, they have all had some underlying illness. Now, again, the take-home from this is that Houston is doing a good job. What we're doing is working. If you look at our neighbors, New Orleans, which is similar in many ways in terms of at least weather, it's flat, it has a population density not terribly different from Houston's, and their situation is far worse, unfortunately. So this is a time to reflect on what has been being done is working, but we need to keep on doing it.
Mayor, from KHOU, Dallas County announced this afternoon they're extending their stay-at-home order until May 20th. Should Harris County do the same? Have you and the county judge had any discussions on that, and what are your thoughts on that?
Well, I think it's important for us to align as much as possible. We align Houston-Harris County with the president's social distancing, April 30th. The governor's now April the 30th in terms of the stay home for the state of Texas. Many of the other cities, April 30th. So I think we just extended the stay the judge did to April 30th. So I think that's a solid date. And I think now it's just important on us for the next 28 days to really hunker down, to be very, very intentional in this social distancing, to take it very seriously. Let's concentrate on the next 28 days without even talking about, going beyond that. Our goal line is April the 30th. And I would love to be able to be here and stand before you and say on April the 30th, we flattened out that curve and we kept it within our ability to handle it, our hospitals. To me, that would be a big victory for all of us.
And speaking of hospitals, they'd like to also know is, do we know where we are as far as our ICU beds, how many we have and what the capacity is?
And we do. And in our next report, probably on Monday, the goal is to start providing you with some of those numbers, the number of beds, the utilization rate, in terms of ICU beds, the utilization rates. I can tell you as of today, we have capacity for our ICU beds. And I'm just not speaking of City of Houston. I'm talking about Harris County, Galveston, Fort Bend, Montgomery, Brazoria, Livingston, Chambers. It's this whole Houston region. So there is capacity for ICU beds, for general admission beds, for ventilators. There is capacity, and we're operating within it for today.
I have a question, if you don't mind, Maya, that specifically relates to this.
Sure.
And Dr. Peirce could also maybe take this as well, but NBC put out a report showing somewhat of a number that doesn't seem to be reported here, where there's a steep increase in 4 days, up 40% with the number of patient admissions that are showing signs of people who might be suffering from coronavirus. And they're also citing statistics coming from the Southeast Texas Regional Advisory Council that shows the daily census of area hospitals here are much higher, a surge. Though we are hearing, through this news conference that there's confidence that our hospital system can manage that. So where is the disconnect there when we're seeing those types of numbers? Yeah. Thank you, Dr. Peirce. Thanks for all you do. Thanks for making that.
So I hear you. And so I don't know the NBC report you're talking about, but I can talk to the CETRAC numbers. And we are seeing an increasing number of patients who are admitted with the diagnosis of COVID-19. It gets very confusing when you look at the data because there's two types of patients when we talk about COVID. Those are those that are diagnosed, that it's confirmed that they have it, and then there are also the ones that we call the persons under investigation, the PUI, which means we suspect, or the people in the hospital suspect that they may be infected. They've sent off the lab, but the lab test isn't back yet. And as we've talked about so many times, depending on what lab the test is sent to, it can be up to 10 days before we get an answer. And so you're right, and as I talk to my colleagues in the hospitals, they are seeing an increasing number of people coming through the emergency department and being admitted, and even in the ICU. So the numbers are going up. At the same time, the hospitals are doing a lot of things to reduce the occupancy in the hospital for the other illnesses. So, for example, all the elective surgeries have been eliminated, and therefore there's vacancy that develops within the hospital. And so as the mayor pointed out, we still have vacancy. The COVID-19 patients are starting to take up that vacancy, but they've not eliminated the vacancy. And so both statements are true. The takeaway from that is what we're doing is working. That's why today we're still within the capacity, but we need to keep on doing it. When you're going through heck, you keep on going, right? We need to keep on doing what we're doing, and hopefully we won't get above the capacity. But you're right, both of those statements are true. I hope I explained it.
Follow-up, what a lot of people want to know from the messages that we've seen is Texas and the Southeast region the next hotspot for coronavirus, and are we prepared for a surge?
Yeah. Do you want me to?
I mean, I take the attitude, every place in the United States is a hot spot. And if they don't think they're a hot spot, there soon will be a hot spot. So the best thing is to assume that every place is a hot spot. If there's coronavirus, you're in a hot spot, okay? Because it starts with one and then it mushroom. In terms of our planning, there are 3 stages of preparation. One is under the current system right now. That's plan A. The second is the surge preparation. within your existing healthcare delivery system and their ability to handle the surge capacity, okay? And they are planning for that. That is within the healthcare delivery system. Plan 3 is when it exceeds the surge capacity for our healthcare delivery system, and then we need to set up additional capacity outside of the walls of our hospitals. And if you notice, like last Sunday, many of us were touring particular facilities that could turn into potential hospitals outside. That's for what I consider to be the worst case scenario when you exceed the surge capacity that's within the hospitals. We are planning even now for all 3 scenarios. We're in scenario 1 right now. Down the road, we could find ourselves in scenario 2, surge capacity within the hospitals. And then down the road, we could find ourselves for scenario 3, having to set up additional capacity outside of our hospitals. We are planning for all 3 right now. Dr. Persif?
So the mayor's exactly right, and that contingency planning for Plan C is ongoing. In fact, we have plans going back to 2009 with the pandemic flu plan. Things have changed, and we're trying to operationalize those, and it's probably a little bit too early for us to give any specifics because I know you're going to want to ask questions about it. We're not ready to give those specifics yet. But rest assured, we're spending many, many hours working on those because there's many moving pieces to that, and so that work is actively being done, yes.
This is a question from KRV for mainly Chief Acevedo about, you've talked about the spikes in the burglaries of buildings, and then, of course, we've been talking the last couple of days about the compassionate release by the county, as well as, I guess, the lawsuit that's coming up. And what they're asking is, what is your position on the Judge Hidalgo release, which actually, I don't know if you're aware, about half an hour ago was actually stopped by a judge. And what they're asking is you to clarify your thoughts on those.
Well, actually, there's been a lot of confusion in this thing because there are several moving parts. The compassionate release, which is what Judge Hidalgo's been working on and consulting with the mayor and with the sheriff, is something that the police department absolutely supports. But there's a second piece. There's litigants, the same litigants that sued on the misdemeanor bail that want to get a lot of other people out of jail, including violent felons, and that we do not support. Neither does any of the other chiefs in the area or the sheriff. And so we actually had a conference call with all the law enforcement today, and we all support true compassionate release of nonviolent. And when you look at the judge's orders and you actually look at the declaration that we put in for the lawsuit, the judge's order actually includes just about everything we put in our declaration in terms of it being case by case, truly nonviolent, and truly a compassionate release of someone that doesn't belong to be behind jail. Because we agree that $10,000 isn't the issue. It's what was the threat that each person poses in terms of public safety, and I think that's what the order, if it's followed, ended up with. And as far as what the Judge Ritchie did, that's a matter of law. That's not for the police department to weigh in on.
Dr. Peth, I just wanted to ask this question. Since we seem to be having a breakthrough and we are containing this global health issue in Texas and around Houston, but let's not forget our immediate surrounding states like Louisiana and what is happening there, maybe other states like Arkansas. So what would you say from an epidemiological preventive cooperation so that we don't get transfers from these states into Texas and whatever effort you're making here seem not to be sustained because of these cases that are coming over the new states. So what would you say are some of the mitigation measures that we could put in place to work with them and also see that they are also coming on board?
So if I'm understanding your question, you're talking about people moving from one area to another?
Yes.
Okay, so if you don't mind, I'm going to let the mayor talk about that because that's his lane. I don't want to get into his lane. But in terms of what we here can do locally is what we've been talking about with the social distancing, avoid large gatherings, all of those issues. But in terms of people moving across the country, that is clearly something for Mayor Turner.
And I love everybody in the United States of America. But wherever you are, stay where you are. I love you, as I said to a very close friend of mine today, I indicated to him he's outside of Texas, and I told him, please stay where you are and enjoy where you are. I think it's a wonderful place where you are. And those of us in the city of Houston, can see you in about 30 to 45 days, you know. But no traveling right now outside of the state of Texas. Let's stay where we are. Final questions?
Yeah, I just want one from Telemundo, and I think she has a couple more from
Okay.
her investigative office.
We're going to do Spanish after. Sam and I.
Okay.
Mayor told me to do Spanish.
Yeah, we're gonna break up and do Spanish. Chief Pena is gonna be in one area, Chief Acevedo is gonna be another area, and I'm gonna be in the center, and we're gonna do the Spanish translation.
We know you've been practicing your Spanish, Mayor, during...
I was practicing last night.
Yes.
Se habla español, no solamente inglés.
So the question from Telemundo is the Supreme... Yeah, but it's not a law enforcement question.
Okay.
So that's why I thought the mayor might want to answer
Sí,
in
sí,
English.
sí. Absolutamente.
The Supreme Court of Texas halted evictions proceedings and actions until April for renters. They didn't know if there was any recourse for business owners who may not be able to pay for their lease in their business, like restaurants and small businesses. Are you aware of what that situation is?
I am not aware, but I will tell you on Monday we are planning another press conference specifically as it relates to apartment owners and tenants, renters. That would be on Monday, and I will try to have an answer for you on Monday at the press conference.
I think Roseanne, if you want.
So on Friday, Governor Abbott had alluded to using NRG as a potential care facility for those COVID-19 patients. Do we have any, confirmation of this or a response to that allusion?
I know in talking with Judge Hidalgo, I know that is a possible site. I don't know if they have firmed that up, but I know it's a possible site. Just like, we are looking at different sites that could be at a capacity. The site we toured on Sunday, for example, it's ready now to be set up as a hospital. It has been serving as a hospital, 68 beds, 21 ICU beds, and it can expand. There's another hospital for example, in the Bel Air area as well that could be used. So we're all identifying potential sites now, just like we identified hotels, for our employees, and we finalized that deal this past Wednesday with City Council. We're looking at additional sites right now, and we'll have things ready to go once we get to that point. We're not going to wait until we need to go to Plan C, but we're working with our hospitals right now for that added capacity, just in case it's needed.
Another question is, do you have any suggestions for mitigating the spread of COVID-19 at area senior living facilities? For Brandon Walker, he wants to ask if, how is the state of senior living facilities and the spread of COVID-19, and is it a dire situation at this point?
So each nursing home is different, and we, the City of Houston Health Department, and I think I can speak for Harris County Public Health as well in this, we're working with nursing homes, especially those who have reached out to us, to bring our folks in there, to go over the processes, look at the floor plan, look at the movement, the flow of people within the facility. And also, you've got your traditional nursing home where people are often bedbound, and then you also have senior living facilities where the residents are far more mobile and have a far more social lifestyle. And so those different scenarios produce different challenges, because we certainly don't want people to have miserable lifestyles where they're locked in their rooms when normally they go and play bridge and so on and so forth. But we need to work with them to make sure those environments are as safe as possible. I would not say that the situation is dire. I would recognize that, of course, we do have across the region some individual nursing homes which have had some tragic events occur, and those, every nursing home needs to, and the staff there need to recognize the potential for that, which they do. They are keenly aware of the potential and striving very hard to protect the residents, but each location is a different challenge, and we are working with them to try and minimize the risk to the residents.
Let me thank all of you. I will say to you that next Thursday, Councilmember Pollard recommended that we have a moment of prayer next week on Thursday. It doesn't mean we gather wherever you are. A moment of prayer and silent meditation non-denominational, but from wherever you are. And I think we're going to do that next Thursday at noon. So at noon next Thursday, wherever you are, at home, in the park, at your place of business, we're just going to ask people just to pause at noon, and to just say, have a moment of prayer. And then, of course, as we approach this weekend, again, let me thank the faith-based community for just being very supportive and working with us in online streaming and certainly engaging in social distancing. And then let me just close. This is a crisis unlike we have seen in our lifetime. And we're doing everything that we can do to keep people safe. I know people look, the numbers continue to rise. So let me just say, I just believe if we do our part, that God will do the rest. And so regardless of who you pray to, regardless of what denomination, let me just say this, even as the mayor of the city of Houston, as an elected official, some may say as a politician, my closing thought in this press conference is my desire. We're asking for PPEs, but I'm going to ask that God will bless our city and that God will heal our land. And with that, enjoy your weekend. Thank you.
Thanks, Mayor.
Thank you all. Appreciate you.